Thank you very much. I'm very, very pleased to be here today. So I'm one of the national coordinators for the Healthy Schools programme. And I'll start by saying that all that I'm going to talk about today, really, I think it's really important to bear in mind it applies to everybody. You know, Healthy Schools, our vision is for healthy, happy children and young people. And we really do mean that, we really take that very, very seriously indeed. And that includes all LGBT children and young people. We're a programme that's 10 years old, so that means we've had the privilege to impact on the lives of children and young people past and present. And we really do want to make sure that for all children and young people, they grow up to be able to live their full potential. For those who are not familiar with Healthy Schools, basically schools are required to meet criteria across 4 themes, 41 criteria, nothing magical about 41, but we just felt that was more manageable than 141 criteria for schools. We're a very successful programme. Literally 9 out of 10 schools are involved in the programme now, and approximately 7 million children and young people attend the school. It's a programme that's jointly funded by the Department of Health and the Department for Children, Schools and Families, and we operate out of 9 government offices with our regional coordinators, and they in turn work with, in fact, 152 local programmes. And I think one of the key things about Healthy Schools is our partnership arrangements, that we have that partnership at all levels. Now, our aims have always been, and they will not change, and that's to promote healthy behaviours, reduce social exclusion, reduce health inequalities and raise attainment. And we know for some children and young people, especially those who are LGBT, is that these are areas that really do affect them, you know, in terms of the bullying they may have to put up with and how they are, some of them, as we've heard already, feel excluded socially. And we know that this has an impact on their health and naturally will have an impact on their attainment. And these are things we take very seriously because as a Healthy School, we want all children and young people, as I said again, to really achieve their full potential. Key to Healthy School is that whatever we do as a whole within the Healthy School is that we adopt a whole school approach to that. And that means looking at issues around those that present for those children and young people who are LGBT. And it's very important that they're able to develop their full potential just like anybody else. And one of the things that we do insist, really, is that a Healthy School must have an anti-bullying policy. But not just in writing, but we expect on a regular basis for this policy to be reviewed with children and young people and really with evidence to say that schools are doing that. And in the main, schools are doing that, and many of them are doing that very well. We want schools to take bullying very, very seriously, all forms of bullying with any children and young people. Now, one of the good things about being part of the Healthy Schools programme is that in terms of our partnership working, we empower schools through links with the local authority and primary care trusts and others to work with the community, groups in the community that can support LGBT children and young people. And that for us is really important, to encourage them to come into schools, to work, to be creative, to support those children and young people, but even more so to really make the message whole school, because that for us is the way in which we are going to tackle some of the bullying and the prejudice that still continues in so many of our schools. As a Healthy School, we're now looking at the next phase of our development, and we are calling it the enhancement model. And what all schools will be working towards is an outcomes-based model. So traditionally in many schools, they may do surveys around bullying with children and young people to find out how safe children and young people feel. And for many schools, 60–70% of children and young people feeling safe is good, and they would think to themselves, fine, we've done a great job, let's move on. But as an example within the enhancement model, one of the things we'll be saying to schools is to identify who those 30% of children and young people are and why is it they don't feel safe, because we really do think it's very important that we can get as close as possible for all children and young people, including those LGBT, to feel safe in school and within the environment. Because one of the good things about that is that when we know that we've achieved that, their attainment rises, and that's great news for the school as well. So it's there for everybody. I'll leave you with a quote from Ed Balls in terms of Healthy Schools and how he feels we are positioned to really lead and drive through a whole range of issues and healthy behaviours as we prepare for the 21st century school. Thank you for listening.